This recording is part of a series of recordings covering an introduction to the nervous system. This recording is specifically going to address myelinated versus unmyelinated axons. We're going to look at the difference between gray matter and white matter, and then also consequences of demyelination. So what I'm going to start with is showing you a model from the lab that's showing you a neuron from the peripheral nervous system. So it's a good way also to review what we've talked about in a previous recording. So here you have the soma. All these are the dendrites that are receiving this information. What you'll notice here, these are actually the synaptic knobs from other neurons. So those dendrites, remember, are going to be receiving a lot of input from other neurons, and it carries that information to that cell body. Here, there's the axon hillock. And what you'll see, they did it so it wasn't so long, they've cut it, and it should be connected right here. This represents your axon. But to differentiate between some things is this gray that you see out here is actually the axolemma. That's the cell membrane of the axon. The axon you see is right in here, kind of that orangey reddish color. This axon happens to be myelinated, so you see all these little layers of myelin that's wrapping around the axon. Certain areas, like right in here and right in here, you have gaps in the myelin, and they're actually referred to as nodes of Ranvier. So if there was propagation of action potentials along the axon, what actually happens is, because what myelin does, it insulates the axon. It's formed up of a lot of fatty tissue and lipids, and that's not going to allow ions to move across, and the propagation of action potentials involve movement of ions across the membrane. Well, they can't go across the myelin, and so what happens is when action potentials are generated, they're going to travel from where you have the membrane with no myelin to the next one, to the next one, and it's actually referred to as saltatory conduction of action potentials, which is much quicker than if it wasn't myelinated. If it wasn't myelinated, it would have to go the continuous length of the axolemma. It would take a little bit longer. Now, what you'll notice on this particular axon, where the myelin is, right out here, you see this, you see it right here, that's actually the nucleus of a cell called a Schwann cell. A Schwann cell is a neuroglial cell whose job is to produce the myelin, and it produces the myelin for the axons in the peripheral nervous system. And what happens is it's producing the myelin wraps and wraps and wraps around it, so it forms, I would say, like a tortilla, wrapping. The outermost layer that you see, which you see if I label this or this, that's actually referred to as the neurolemma. So I'm going to write that out, the neurolemma. So the outermost nucleated layer of the Schwann cell is referred to as the neurolemma. Now, the neurolemma is important because it will actually help to form a tube that, if there is injury to an axon in the peripheral nervous system, it'll help to form a tube to help guide the regeneration of axons. Now, on this model, it also shows you here in gray, it's been peeled off here, but you see it right here. That is a tissue called the endoneurium, which is a connective tissue membrane that's around axons. So if it's myelinated, you'll see it right around the neurolemma. If it's an unmyelinated axon, it'll be around the axolemma. The connective tissue membrane is actually formed up of dense irregular connective tissue, helps to kind of provide support for that axon, also supporting blood vessels that need to go and nourish that axon. So that you'll learn about some other connective tissues, membranes that are associated with our nerves. An axon is just one component, small component of a nerve. So that here, that's actually showing you what we call the endoneurium. Now, see if there's anything else I wanted to show you. No, I think that's it. Here, see a similar picture here. This is a slightly different model, but again, you see all how that myelin is wrapping itself around. The light blue is the axonal lemma. This one really shows you much better where you see the gap in the myelin. So that's the node of Rambier there. So the impulse would travel from here to here and propagate down. The neurolemma is this outermost layer right here. So that's the neurolemma. Now, the peripheral nervous system, the axons are myelinated by those Schwann cells. Though, and I had mentioned also that significance of that neurolemma. So here's another picture to show you a different view. So you see the axon right here. You see all those layers of myelin. Outermost layer, you see where the nucleus is. That outermost layer is referred to as the neurolemma. Okay, so it's called the neurolemma. So what happens if I have an injury to the axon? Well, what will happen is that say I have an injury right here, this part is going to degenerate. And what will happen is the proximal end of the injured axon will start to regenerate, and that neurolemma actually forms kind of a tube that helps to that regeneration to be directed to where it needs to go. But I have to mention, it's not, if you have an injury to an axon in the peripheral nervous system, there's no guarantee you'll have complete regeneration. There's also no guarantee it will go to where it needs to go. So some people do end up with some permanent damage as a result of injury to the axon. Now, if you injure the cell body, that neuron is going to die. Now, in the central nervous system, if you damage an axon, you most likely do not get regeneration, because some cells that we're going to be talking about later do not permit that to happen very well, because it does not want axons willy-nilly going around within your brain, in your spinal cord. So it's like, no, you're not going to regenerate. So unfortunately, if there is damage to an axon in the central nervous system, there's a large percent that it won't regenerate. But there's more research going out now to allow things to happen, even though we have injuries, say, to the spinal cord and into the brain. Now, one thing I do want to mention is myelination in the central nervous system. There's a different cell that produces the myelin, and this is the name of the cell. It's called an oligodendrocyte. On this picture, they're the ones that look like little eyeballs. So if you notice here, these processes come down, and you're seeing right around the axon. It's wrapping around the axon. So you see the myelin right there. So in the central nervous system, so in the spinal cord, in the brain, axons are myelinated using a cell called the oligodendrocyte. Now, one of the things that comes in play when we talk about myelination is something called gray matter versus white matter. So I'm going to show you what the gray matter and white matter is in the brain and the spinal cord, and then I'll tell you what it's made up of. So in the spinal cord, here's you got a cross section of the spinal cord. The gray matter is interior. See it right here. Kind of looks like a butterfly. To me, it looks more like a bikini top or a bra strap. The white matter you see is here. Now in the brain, here is a coronal section of the brain. You see gray matter on the outside here, where this is part of the cerebral cortex there. And you see some gray matter in the inside too. And then all this is white matter. Okay, so what is the difference between white matter and gray matter? Well, white matter consists of bundles of myelinated nerve fibers. So white matter is where it's those axons that have been myelinated. They're transmitting information. So they're areas of nerve conduction and transmission. The gray matter consist of groups of cell bodies or unmyelinated nerve fibers. Predominantly, you see a lot of cell bodies there. Now, the reason why, or actually before this mentioned, so the cell bodies is the area of integration. So the cell bodies are where we process this information. Now, why is one considered gray, one versus white? Well, I had mentioned in previously is that in the cell bodies, you have all that Nissl substance. So it picks up the certain dye and it stains it darker. Well, in some sections, depending on kind of what dye that you use, it's going to appear gray. And areas where you don't have the cell bodies, it's going to look white. So that's why they call it gray matter versus white matter. What's important to know is, what do we find in gray matter, what do we find in white matter, and what's their function? So gray matter is where we have integration. This is where we have the cell bodies. So for example, here in the cerebral cortex, this is one where we're going to say interpreting conscious information. Oh, I touched the snake. That's happening in the gray matter. Now, how the information got there, it had to travel up via the white matter, up the spinal cord, up here, and eventually to a certain area in the cerebral cortex where I interpreted it. Then, like, I want to drop that snake. It starts up in the gray matter, but that information has to travel down to those muscles that are going to allow me to throw that snake away from me, and it has to travel down that white matter, down eventually to and carried along the nerves. Now, gray matter and white matter is not just associated with the central nervous system, not just the brain and spinal cord. In the white matter would be in the spinal nerves. That would be all those axons, the myelinated axons. The gray matter would be where we find those cell bodies, but they're not going to be found within the central nervous system. We'll talk about that at a later date. So what would be a consequence of lack of myelination? So I previously had mentioned having myelin allows the transmission of information much quicker. Now, not every axon in your body is myelinated. It takes up room, can't do it. But we do have, especially part of the peripheral nervous system, those nerves are heavily myelinated. Is what would happen if we start losing the myelination? Well, I'm going to give you two examples of demyelinating disorders. Multiple sclerosis, or they refer to as MS, is a demyelinating condition that's associated with the central nervous system. It can result, at some point, it can result in damage to the nerves themselves, but it starts off with losing myelination. So as a result of losing myelination, information can't be carried as quickly. So problems with sensation, motor control, cognition can result from it. Guillain-Barré syndrome is a demyelinating condition that affects your peripheral nervous system. That is actually the most common cause of acute non-trauma related paralysis. People will have sudden weakness in their hands and their feet, and then it can migrate. And often Guillain-Barré syndrome is considered to be a result of some sort of infection, some viral infection. There was a year or so ago where there was a Dallas Cowboy that was recovering from Guillain-Barré syndrome. So it was a demyelinating condition. Obviously couldn't play football, but it took some time and there was no permanent damage that resulted of it. But once the myelin regenerated, came back, then function restored, and it takes a little bit of time. They think it's a response to some sort of virus or toxin, and our immune system starts attacking some of the components of myelin. That's what they believe could happen. Now, these could be lead to death if there is damage to the nerve themselves, especially if it's associated with the autonomic nervous system or respiratory muscles. So these can be lethal conditions. Oftentimes, like with people with MS, they'll have periods of where they're having issues with some problems with sensation and cognition and motor control. But then you'll see some improvement, and it's because of the myelin coming back. But while when they lose the myelin, then they're going to not be able to transmit information as quickly. So these are just kind of an introduction to some demyelinating disorders. So this is the last bit of this recording. Look for a recording about the glial cells, two of which I've introduced to you already, the oligodendrocyte and the Schwann cell.